tuck for extra security. All right. Hold my hands in the cold. And so now the way that they tell you on their paper, they tell you to apply the lotion from the head down. But normally, if you're working from somebody's legs and you're working up, you'll already be at this point and not necessarily. So to cut out all the walking, you can go ahead and start from the side of whatever side you're on. So you'll come down just to start warming up the tissue. Now from here, you will probably want to go into Palmer. As you're getting a little bit deeper, you'll go into a Palmer stroke, but I'm not applying a lot of pressure here. It may look like I am. So you'll use palm pressure. Then it suggests loose fist. Okay, you right?
Yeah.
Then they suggest that you do thumbs down to your erectors. Get a little circular motion right there at the SI joint. But each time you go down, you're going further and further out from the spine so that you can make sure that you're getting all the erectors. Then I start concentrating on one side, and now I'm doing stacked thumbs down the erectors. Or you can actually do 3 fingers. And I use that sort of as a transition move to come down to the side of the table. So on about my 3rd stroke, I will transition to the side of the table. Then I believe they're asking for circular with your fingers at the paraspinals. So I'm doing circular.
I lost it.
I think that's step
Circular friction along the paraspinal muscles of the lower back using the fingertips.
So what I'm doing is just that. And then I usually make about 2 or 3 trips doing so, and each time I come out a little bit further from the spine myself. And I'll do a little FRR stroke there. That's just me. Then you will do, I can't remember what they're, something about thumbs.
Slide the thumbs along the spine in strips, so thumb stripping, to the paraspinal and quadratus lumborum in the lower back. And then move both inferior to superior and superior to inferior.
All right, so what I'm doing is I got my thumbs together, and what I'm doing is I push towards the spine, and I can feel each group of the erectors. And I just kind of do that, and then I go another step, and then do like so. And I'm staying in between that space of the lower rib and the top of the hip. So the QL is in this space here. Okay, right? And then I slide out a little bit, and then because when you slide along there, you can feel each of the bands of that of the erector group. Alright. Then after that you use direct pressure.
Yeah, to the points on the low back. Press into the paraspinal muscles from the side. Move from spot to spot from below the last rib to the iliac crest and hold for 2 to 3 seconds each.
So what I'm doing is that same way I was doing it, except for now what I'm doing is I'm staying static and I'm pushing it. Hold for about 2 or 3 seconds. Go down a little bit further and press it again. Then I go to the next group and I'll do the same thing. Then you go back to this little shimmy thing. And what's next?
Lift sides of the waist with deep effleurage strokes from the side. Move to the opposite side and reach over to apply lifting effleurage to the waist area that was just massaged.
All right. So when they talk about lifting the waist, they're actually talking about, you see how when I push into her, the waist goes when I push into gray. Now, they're saying transition to the other side. I usually will use this as a transition move because I'll come up and then I'll go down that same side, so my hand will already be in place. And how you do the adductors, you kind of lean, so you're doing the same thing in that space. You're getting the QL, you're getting the ribs, and all of that. So just kind of let your fingers fall in between the rib cage and into the side, into that space. I usually kind of finish out with a little petrissage. And now I'm already on this side, so then you repeat everything you did on that side.